Hi guys, and welcome back to Pharmacy Skills, and welcome back to another video. In this video we want to look at B12 deficiency, metformin and PPIs clearly explained. Okay, so you have a patient that has type 2 diabetes. They've been taking metformin for years and maybe a PPI, but they come in and they complain saying that they're tired all the time, they feel numb, they're not thinking as clearly as they used to. So, you look into their bloods and you see that their blood sugar levels are pretty well controlled. The HbA1c is fine. On paper, everything looks fine. Nothing dramatic, just small changes. And because nothing obvious is wrong, these symptoms can often get brushed aside. Very often, the real problem might be worth considering vitamin B12 deficiency. So the first thing we need to ask ourselves is, what is vitamin B12 and why does it matter? Vitamin B12 is a vitamin your body needs to do three main jobs. First, it helps your body make new cells, especially red blood cells, which carry oxygen around the blood. Second, it helps your body repair and maintain nerves, which obviously carry electrical signals between your brain cells and the rest of your body. Third, it helps your brain function properly, things like memory, concentration, and mood. So when B12 levels fall, the effect often shows up in reduced energy, the nerves being affected, which we'll discuss in a minute, and thinking, concentration. Okay, let's start with metformin first, and then we'll look at PPIs. Metformin is one of the most commonly prescribed medicines in the UK. It lowers blood glucose by improving how the body responds to insulin. But also in other countries as well, like in the US, it's also one of the most commonly prescribed medicines for type 2 diabetes. But one of its long-term side effects is that it can reduce how well vitamin B12 is absorbed from food, and we'll look at the mechanism in just a moment. Let's start by a simple picture of how B12 is absorbed. When you eat food that contains B12, your stomach and intestines have to do a few steps to get it into your bloodstream. One important step happens in the small intestine in a section called the terminal ileum. This is simply the last part of the small intestine before food moves into the large intestine. So in this part of your gut, vitamin B12 is absorbed into your body. Metformin, however, interferes with this process. It doesn't destroy B12 and it doesn't stop you from taking it. It simply makes the intestine less efficient at absorbing it. So over time, usually over many years, in fact, for this to happen, it will slowly drain the body's stores of B12. And this is important because the body stores B12 in your liver. So deficiencies will develop very slowly and over a long period of time and very quietly. So a patient can feel fine for years before symptoms just start to appear. Now, there is something crucial. Low B12 can also damage nerves. This damage causes symptoms like tingling, numbness, burning sensation, or even weakness, especially in the feet and the hands. But we also know that diabetes can also cause nerve damage. So when patients with diabetes who develop numbness, we're often told that that's diabetic neuropathy. Neuropathy simply meaning nerve damage. But in some patients, the nerve damage isn't from diabetes at all. It's from B12 deficiency caused by metformin or some other drug, as we'll look at. Speaking of other drugs, let's now look at the second group here, PPIs. So PPIs, drugs like omeprazole, lansoprazole, drugs with a prazole suffix, these reduce stomach acid. They're used for indigestion, reflux, and also stomach protection. But stomach acid, although it sounds a bit unpleasant, it actually has a very important job. One of these jobs is to help release vitamin B12 from food. You see, in food, B12 is tightly attached to proteins. So stomach acid helps break these proteins apart, freeing the B12 so that it can be absorbed into the intestine. So when someone takes a PPI long term, stomach acid stays low. Less acid means less B12 is released from food. Less B12 release means less B12 is absorbed. Again, this doesn't cause an immediate problem. It's a slow effect that builds up over many years. Now imagine a patient who is both on metformin and a PPI. One drug reduces B12 absorption efficiency in the intestine. The other reduces B12 release in stomach food. Together, they significantly increase the risk of deficiency. So how does deficiency show itself? Some people will develop anemia. They don't have enough healthy red blood cells. This can cause tiredness, breathlessness, and even paleness. But, and this is very important, nerve symptoms can appear before anemia or even without anemia at all. That means Blood tests might look mostly normal while the patient is already developing nerve damage. And symptoms of nerve damage can include tingling or numbness in the hands and feet, problems with balance or walking, memory problems or brain fog, as some may call it, low mood or depression. In older patients, B12 deficiency can even look like early dementia, when the real cause is really B12 deficiency. So it's important to consider. So let's now look at how B12 is prescribed, doses, and some things to bear in mind. So in the UK, vitamin B12 replacement comes in two main forms: injections and tablets. Let's start with injections because that's what most people commonly associate B12 treatment with. The B12 that is in the form of injection is called hydroxycobalamin. So this is a form of B12 that stays in the body for longer periods of time than the other forms, which is why it's preferred here in the UK. It comes in ampules. Each ampule contains 1 milligram, which is the same as 1,000 micrograms of B12. The injection is given into the muscle intramuscularly, usually the upper arm or the thigh. The dose will depend on why the patient is deficient. If the patient has neurological symptoms, for example, numbness, tingling, balance problems, or memory issues, the treatment is more intensive. They're usually given about an injection every other day. It could be a couple injections, maybe 5 or 6 injections over a couple of weeks. If they're not really having nerve damage symptoms, they could usually go for a starting dose that is maybe 1 milligram injection 3 times a week, or maybe even twice a week. And then after the initial treatment, when they've sort of like replenished the stores, the treatment or the maintenance dose is usually going to be about 1 milligram every 2 to 3 months, often for life, if the cause of the deficiency is ongoing. Contrasting that with oral B12, B12 tablets are available on prescription and you can also buy them over the counter. The common forms of it include cyanocobalamin or methylcobalamin. Tablets come in a few varied strengths. You can get them in 50 micrograms, 100 micrograms, and even 1,000 micrograms. The key here to understand is that even when absorption in the gut is poor, a small amount of B12 is absorbed passively. That means it gets through without using the usual absorption system. Because of this, high-dose oral B12 can still work for some people. So the use case for oral B12 is if the deficiency is mild, there are no neurological symptoms, or the cause is dietary. For example, vegans, or injections are not suitable or preferred by the patient. Typically, the oral dose may be 50 to 150 micrograms daily, or in some cases 1,000 micrograms daily. But oral B12 is usually not first line in people with severe deficiency. Can you overdose on B12? This is something that we looked at in our vitamins video. It is a water-soluble vitamin, so it is very, very unlikely. There is no established toxic upper limit of B12. It easily gets cleared away in the urine, so it's quite hard to have a toxic amount. I mean, on occasion, some people may report mild side effects like headache, nausea, or skin reactions, but these are very, very uncommon. So from a safety perspective, B12 is very forgiving. The last thing I want to mention here is some foods which are high in vitamin B12. That includes red meat, liver, fish and shellfish, eggs, milk, cheese, and even yogurt. So plant foods do not naturally contain B12 unless they were fortified, meaning that B12 was added during the manufacturing process. I hope you guys found this video useful. I hope to see you guys in another one.